Hey everyone, this is Rosalina.
And this is Shauna, and we're your hosts for Too Young for This Shit podcast.
This podcast is not just about boobs, but our journey with cancer. We are young millennials, open about giving you our raw and unfiltered look into our lives. We are in no way medical professionals, nor are we offering medical advice. Any medical references are cited directly from public websites or from our personal diagnosis. Some topics and stories may be triggering to those who are fighting, have fought, or have loved someone with cancer. Hey everyone.
Hi.
We are at our last and final episode, our season finale, and it's incredible how far we've come in this journey. I could just remember when I first found out I had breast cancer. So it's been a really long, I don't know how many months it's been, like 8.
I mean, I was diagnosed in January. For me, it's been a solid 10 months.
I was diagnosed in February, so 9 months.
I feel like the last couple of weeks, I just keep thinking to myself, like how much our bodies have been through in the last 10 months. I can't get over it, how much we've endured.
Yes, I am so shocked in how our bodies are coping with all of these medication that we have to deal with, and internally, like what our body is going through, and obviously externally too with radiation. So I think it's incredible how much our body can go through all of that. And I'm so appreciative I'm still standing.
No, definitely. Definitely. I sat down and I was like, I've gone through 2 egg retrievals, a double mastectomy, lymph node removal. How many scans? I mean, how many doctor's appointments? 16 rounds of chemo. I have to, I'll start tomorrow, actually, 25 rounds of radiation. But like when that all adds up, like it just seems crazy. In 10 months, like all of that has happened in 10 months.
I'm sticking that in. That is a lot for someone to go through. And we had our really bad days, especially in the beginning of my diagnosis. I was just on the floor, like hysterically crying. I didn't know I was going to go through this. And this is the start of my journey. And then, remembering about my surgery and how I'm just like, damn, I'm going to lose a breast. And then chemo, where I'm like, damn, I'm going to feel like shit. And I also didn't feel like myself. I feel like chemo was definitely the time where I struggled the most. I lost my hair, lost 90% of my hair. I didn't feel like myself. I was just sitting on the couch, watching TV, just resting and doing it all over again the next day. And so that was really, really difficult moment for me.
Definitely chemo was the worst part for me. I cried a lot during chemo. Like that was hard for me. I mean, just everything hurt. My entire body hurt, and I lost a lot of hair too. I mean, I definitely am a success story when it comes to the Paxton cooling system because of how much I did save, but it was devastating, like you said, and just what your body's going through. I mean, not being able to fully live my life was hard too. I wasn't able to make plans because I didn't know how I was going to feel. And, having cold caps, kind of ruined my summer. Like I had to stay cool, like couldn't be in the sun. And, it affected so much of my life and not, my body and my life. I'm weirdly shocked that I didn't have like more freakouts. I am a big reactor. Like I'm somebody that have very strong reactions. And I think this kind of gave me a little bit more of like a tougher skin. It's very hard these days to get any type of reaction out of me because I think I'm just so desensitized to even like any bad news or anything going on around me these days. I think I'm just still in some sort of like a shock of how I have like coped with this.
Yeah, I 100% agree with you about like desensitizing bad news in general. I think this journey has definitely made me have like a tougher skin as well. But I also sometimes just feel like a statue. Like,
oh yeah, like,
just, just really whatever information you get or things that you're going through, especially like with chemotherapy, you're like, okay, like I'm going through chemotherapy again this week and going through the motion because like, obviously you have a choice in what treatments you want to do and if you want to do them. But of course, both of us wanted to do that in order to save our lives, or what we think would save our lives. And so it's just going through the motion of like, okay, I have to do this.
Right.
That's why I felt like a statue, because I'm just like, okay, well, I can't do anything about it.
Yeah.
Like, why would I cry? I'm just going to go through this and it's going to be painful, but it's for the best. Like, that's what I think about.
I often think, do I have tough skin because we've been through all of this, or is that trauma? Like, am I just traumatized and that's why I don't have the reaction anymore? It's something I'm working through in therapy.
Yeah.
I needed to. Yeah. My boyfriend was he was my biggest support system. My sister, my dad, my friends, like I had the most amazing support system. Like, I can't thank them enough. But when I'm sharing my fears, I felt not that it was toxic positivity. I genuinely think that they know I'm going to be okay. But I needed somebody to like be able to share my fears with that didn't know me. It felt good. When I go to therapy, I say some fucked up shit and I feel okay saying it. There was points during chemo, like AC, that I said to Matt that I wanted to die multiple times because I felt so awful. Having to put him through that, like put that on him to where he feels like she wants to die. That's scary. And I didn't want to do that to my family. And I didn't want to do that to Matt, my partner. I needed an outlet that was separate from my support system. I highly recommend it.
Absolutely. Absolutely. Before I was diagnosed, I got a therapist for other reasons. I was having like a really bad mental breakdown at work. Just felt like I needed to really cope and talk to someone about this. So I started to see a therapist back in December 2020, but I think it was like perfect timing because, with this diagnosis, I already found someone who I really liked and I really bonded with. That was a positive in the sense I did have my moments that I cried in front of her and I felt comfortable crying in front of her. I'm just thinking about, my last couple of like therapy sessions that I had with her, but I sometimes pretend that everything is fine, where I don't think I'm giving myself enough grace to say like that I feel different or struggling with things in life, because I try to put this like facade of I'm strong and I can deal with this when it's okay to not feel that way all the time. I definitely need to give myself more grace.
That was one of the things that I did do throughout this experience. Like and anybody that I spoke to out anybody that I've met in our support groups and things like that, like we need to give ourselves grace. Like this is hard, extremely hard, like mentally, physically. Like you said, like you're not going to have good days every day. You're not going to have bad days every day. But it's like, okay to accept those moments that aren't good. Like, I'm not okay today. And that is okay.
One of the things that I'm currently struggling with, I'm really afraid of lymphedema. I'm going to be completely honest. I'm just so afraid that would happen to me. So one of the things that, I am trying to do is maintain my weight or maybe lose a couple pounds. Because one of the things about lymphedema that I did hear about is that it's more common in people who are more obese. So I really don't want to be in that position where I'm like gaining weight and I'm not controlling it and then it gets worse. So I had a moment on the plane where I was coming from Las Vegas to Los Angeles and I was wearing my arm sleeve and I get out of the plane and then all of a sudden I see my left hand. I'm not wearing a glove and I see my left hand and I see it like a little puffy and swollen and I freak out. I freak the fuck out. My boyfriend's like, what's going on? I was having so much anxiety because I felt like I was having the symptoms of lymphedema. I was so scared. And so I was rubbing my hand. I was rubbing it. I was like, oh my gosh, why is it so puffy? I took my sleeve off. Then I was in the taxi and I was like rubbing it. And then all of a sudden I see like my veins again. And I felt, at ease. But also I remember that I had my session with my PT the next day. It was like, okay, I'm going to tell her what happens. And she basically recommended for me to purchase a glove. And I was like, yes, I'm going to purchase a glove. So whenever I'm on the plane, I'm going to wear the sleeve and also the glove because I'm afraid of this fucking shit.
Yeah, I haven't flown yet. So I mean, I have the sleeves because I wore one after my lymph node surgery just because it felt better.
Ah, yes. Yeah.
It did because, you know, that feeling of like that chafing feeling, I couldn't stand it. And it helped so much after. So, I mean, I have the sleeves. I know I have to use them when I fly. I just haven't done it yet. I mean, that's so valid. The lymphedema fears. And the fact that it literally can happen at any point. It could happen 20 years from now. Yes. It's not just like within the first year of surgery. I mean, it's literally forever. Yes. And it's, you know, even getting our nails done, getting your cuticles cut, like that could cause it. Any type of infection can cause it.
I know. I was at the nail salon the other day and the nail tech cut me, but it was on my right hand. And she was like, "Okay, sorry." And I was like, "It's okay." And then in my mind, I was like, it was just on the right side. As long as it's not on the left side, I'm fine.
I mean, that's super valid. And like, I'm struggling with my body right now as well. You know, I think between COVID, I gained a little bit of weight, and then I gained weight being on chemo because I wasn't regularly working out. I was walking and stuff, but you know, it was hard when you're only washing your hair once a week and you're sweating. I did the Peloton a bunch and like tried to stay as cool as possible, but like I didn't want to have like 4 days of sweat build up into my hair and then I can't wash it. I tried to be as active as I could in a way that made me feel comfortable. Zoladex injections are killing me. I've gained so much weight in my stomach, and when I gain weight, it's in my thighs and my ass. It's never in my stomach. And now I just feel like I'm big everywhere except my chest. I feel like I don't even recognize my body anymore. And the thing is, my breast scars, like my double mastectomy scars, do not bother me. They don't bother me at all. I'm more bothered by how my body looks right now than my breasts do. And that's hard. It's hard when I'm like trying on clothes from last year and they're not fitting me correctly and I'm uncomfortable in jeans. I've never had any type of like gut before and I feel like I do right now. And, you know, I'm super struggling too. Chemo totally like messed up my gut. You know, I still have like severe heartburn all the time. Like I just feel bloated and struggling with my body image right now a lot. I'm struggling with what my new normal, and I say that in like quotations because I hate that saying, but like I'm struggling with that. What is this going to be like? The fear of reoccurrence or the fear of lymphedema. I mean, it is a lot to process. And I had heard going through cancer, it's always worse after. Everyone always said that. And I was like, I don't know how, like, because chemo was the worst I've ever felt in my life. And I don't know how it gets worse than that when treatment stops and your support system isn't there as much for you. And just everyone thinks that you're okay now. You know, you finish treatment and you're cured and you're good to go. And I'm mentally struggling.
Yeah, I don't know. Like for me, at least, I feel like I'm fine mentally for now because chemo really took it out of me. Like I was really tired. Was so tired to the point where I couldn't even exercise. I couldn't even go outside and walk my dog because I would get dizzy. At that time, at that moment, I didn't feel like myself. And now it's almost like 2 months out of chemo. I do feel a bit better than what I felt during chemo. I feel I'm getting myself back in some way. My boyfriend, Brian, even says like he can tell that I'm being myself again. That's really positive for me. But again, this is a journey. And so probably, you know, going deep into radiation, I might feel differently. Going through hormonal therapy, which I'm also afraid of, I can feel different as well. So that's what I was like telling my mom yesterday. I was on the phone with her and she was just kept telling, oh, you know, be positive, be positive. And then I was just like, listen, I'm going to have good days and bad days. Today, I feel fine. Today, I feel positive. But like there are things that are coming up that are going to affect my life. And I probably might feel shitty. It might be, you know, a day or two, a week, a month, like who knows? Right now, I feel fine. What you just mentioned, after cancer, it's a whole different viewpoint.
Yeah. I posted something on Instagram a few days ago. It kind of reminded me like your conversation with your mom, you know, like being positive. And it says hard pill to swallow. A lot of us practice emotional avoidance and call it a positive mindset. Be positive. Don't deal with your shit, you know, and it is emotional avoidance. We're not we're not feeling the feelings when we need to feel them.
Yes.
And we push it back and it ends up being worse. It always ends up blowing up in your face. Like, I could sit there and try to be like as positive as I can be. Doesn't mean my shit is not my shit. Like, it doesn't mean that those feelings aren't my feelings.
Absolutely. Yep.
Yeah. I don't know. Just that conversation just reminded me. And I loved that post. Like, it is so true for so many different situations too. Not just cancer.
Yes, absolutely. Yeah. Maybe you all can relate to this, but like, my mom is always trying to say that, like, be positive. I see why she says it, but again, like, that's why yesterday I mentioned to her, I'm going to tell you the reality. Things might not go well for me. Who knows? The best thing that you can do is just be there for me. That's the best thing. But another thing, actually, so one of the things that I struggle with too is that sometimes when I'm hanging out with other people, I just sometimes think about, I had breast cancer and I went through all of this and these people haven't, and I feel different. I'm trying to be like relatable whenever people would ask me, what are your hobbies? Or like, what have you done in LA so far? And I'm really trying to black out all the things that I went through during chemo and just be like relatable.
Right.
And sometimes it's a struggle for me because that was a huge part of my life this year.
I kept my circle super tight and small and, was never really in situations where I met like a ton of new people. From how much hair I saved, and I always wear a baseball hat, basically. I'm wearing one right now. Anybody that didn't know me didn't know I was going through treatment for breast cancer. And I didn't experience what you're experiencing. But I have experienced I had a friend who kind of vented to me, which was totally fine. Like, we all are going through things every day. And, and she had said, she's like, I can't even believe I'm complaining to you. Like, you have enough going on. What you're going through is so much worse. And, and I've always been in the mindset of, I dealt with a lot as a child, like my home situation was really bad growing up, and everyone's trauma is valid, like, just because right now maybe my situation is worse than yours, like, doesn't mean that you should feel sorry for what you're going through. And I'm dealing with a lot of that. A lot of people don't want to tell me things. They feel like they don't have the right to complain because of what we're going through.
100%. What you mentioned, everyone's trauma is valid because like they are going through, like, just because they're not going through cancer doesn't mean that all of their other problems are not valid. Like,
right. Trauma is trauma and it does not matter in any, like, there's no levels of it.
Right.
Trauma is trauma.
Yes. And also, like whenever I'm on the phone with my family or like my best friend, I like when they just tell me things, that are going on in their life, because it's not just all about me. Sometimes I even want to like talk about myself. I just want to hear about, what you're going through. And yesterday I was talking to my best friend, Gabby, and she was just telling me about work stuff and like what she's going through and her love life and all of that. And I just loved hearing it because I want to be interested in what you're going through too. Like, it's not just about me. Like, everyone has their life that they need to live.
I agree. I am also one of those people. I am always, especially like my people, I am my people's biggest fan. Like, you're having a baby, you're pregnant, I'm so fucking pumped for you. You're getting married, I'm so pumped for you. You got a job promotion, I'm pumped for you. But I have felt, my best friend had a baby in May, 2 or 3 weeks before I was starting chemo. One of my best friends right now is newly pregnant. And I almost feel like they're scared to share their happiness with me because we talked about our fertility stuff. I might not be able to have a baby. I might have to do a surrogacy. I may not have enough viable eggs to ever carry my own child. And like, I feel like they feel bad sharing this type of news when like I might not ever be able to share that news. I am not engaged. I'm fine with not being engaged. I'm fine with my situation. Me and my boyfriend are in a really great place. Even after cancer, we're good. And I don't need a ring on my finger to validate my relationship, or I don't feel I need to be in competition with anyone or in this life stage competition. I don't. I'm never disappointed. Like, my shit is my shit, but I don't want people to not share things with me because they think I'm too fragile, or I'm going through something bad, so they're not going to go brag about all the good stuff happening to them.
I don't know. You said it so well, Shauna. I applaud you.
Yeah, I'm not in competition with anybody, like, at this point, And don't get me wrong, like, I had the pity moments of being like, my best friend just had a baby and I'm going to do my first round of chemo. I had that moment. It's more of just being like, this is my life. Like, she's having such a happy, like, memorable time in her life, and my life right now is shit. But it was never of like, I'm jealous or I'm not happy or I feel envious. Like, it was just more of like, good things are happening to everyone else, and this is my life right now. I did. I'm not gonna lie. I did feel sad. That's normal. It's normal to feel that too, and nothing to do with not being happy for my best friend.
But also just like realizing that you are thinking that way, like you don't want all of your feelings to be stuck inside you. Like, it's good to talk about those things. It's good to realize that you're thinking that way, because it is true. Like, we're going through a really bad time, and you're seeing your friend getting pregnant, or you're seeing your friends getting married, while I'm seeing, my friend living their life and traveling and all that. And I can't do that. Like, yes, it is upsetting. It is sad. And that's just life. Everyone goes through good and bad moments.
I think that was actually probably one of my darkest ones. Like, I just remember, like you said, not being able to travel, like not having plans. I didn't have a vacation scheduled. I didn't have, other than like the last date of my, like, my last chemo date, that was like the only thing I had to look forward to. I remember being hysterical and crying to Matt and being like, when is something good going to happen for me? Like, why am I not, I'm like literally getting emotional thinking about it, because is something good ever going to happen for me? I just felt like it was like shit on top of shit on top of shit that just kept piling up, and all the people that I love are having these amazing things happening for them. And that was hard. I just felt like I almost wasn't worthy of, something good happening. Yeah. And that was like that was hard. That was really hard. It's hard to even talk about it now, even being out of chemo and like now being able to maybe travel. I'm still not comfortable, and good things are happening for me, now, but it's so raw for me, I think.
But I mentioned in the beginning, I'm not giving myself enough grace. Like, I block those thoughts, and I don't think it's good for me either to block those thoughts. You realize these things, and, I look up to you because I need to start realizing these things and letting myself cry and letting myself be sad about moments like that.
And they're okay. It's moments, like, it was hard, like I said, in that moment, especially like of not having anything to look forward to, I think was, probably that's a low in general. I'm going through chemo for what? Like, what? I have nothing planned. I have nothing good that I have something to look forward to. That was, like, that itself is a hard moment, and then on top of just everything you have to put your body through and everything you're going through. It was probably the lowest I've ever felt in my life. And I recognize it, it's like, okay to feel it, but you don't have to live there. You can feel it, move on from it. I still feel, like that my feelings in that moment were valid. I'm not going to feel bad for having a moment of having a pity party. That was my pity party.
Your feelings are very, very valid. Anyone who's going through this would say, yes, Shauna, I had those thoughts. Yeah. I had those moments.
Yeah, I think that's the first time I cried on the podcast. Yeah. We did voice memos throughout during chemo, and there was raw moments, and this is real. Like, these are the real feelings people going through treatment, and it's fucking okay to be vulnerable.
On this next section of the episode, you are going to listen to the voice clips of Shauna while she was undergoing chemotherapy.
So I'm home from my first day of chemotherapy. My drug regimen was AC, and I am miserable. I am so nauseous, and I've taken both of my anti-nausea medicines already, and it's not working. My head is pounding. I drank at least a gallon of water today, and I just feel like complete garbage. I just really cannot wait for this to be over. I'm like over it. It's only day 1. It is day 2 after my second round of AC, and I feel pretty terrible. I'm like super nauseous even with both meds. I just feel like super hungover. And I just didn't think it was going to hit this quickly. But I just, it's not as easy as I thought it was going to be. And it's not as, I don't know. Currently at my 3rd chemo session, and I am struggling. The cold cap is just really annoying today. I've had a headache the whole time I've been here. And I've also have cried probably 80% of the time I've been sitting here. Just today is just not going well at all. At all. Just can't believe I have to do another 13 rounds after this. I am over it. I'm so over it.
I like literally crying, like having to relive that. Like I remember that 3rd chemo, I cried the whole time. And then I remember feeling that and feeling just like, I can't believe I have to do 13 more rounds. Like,
yes.
Yeah. I just remember feeling that. It was so terrible.
I can't believe that, like how many rounds you did? Like 16?
16.
Yeah, I can't believe you did 16. I am still in shock.
Me too.
You mentioning like, I have to do 13 more, like,
and then feeling that terrible and just like, the PTSD that I had going bi-weekly, knowing that I was going to go and then feel like shit that whole week. Like day before, I was a disaster. Like I literally was just, having to mentally prepare to go through that, to feel like shit was just as worse as sitting there with this cold cap on my head and getting, this red devil medicine pumped into my body. Like the whole thing was so bad, so horrific.
And then like the smell from the capping as well, just like didn't help at all.
I mean, everything that was like trigger, I speak to a woman who I met actually in one of my nanny groups that's going through the same thing. And she just finished her 4th AC. And I just remember telling her, like, just get through AC and the taxable will be much easier, I promise. Like, even seeing her posting her pictures and, thinking about the rounds and just how terrible I felt after each of the 4 rounds of AC, that I just, like, it triggered me feeling anxious for her, remembering what that felt like. Going back, like, I remember that day. I think like I said, I cried 80% of that day. Like, I was just so upset and so, even my first clip being like, it's day 1 and I'm fucking over this. The worst feeling for me is being hungover. It's the worst feeling. I need to be like horizontal. I can't sleep because I'm so miserable. It was almost the same symptoms. Like, and it was like that for 4 or 5 days, after. And then just like everything hurt. Like my whole body hurt. Like my hair hurt. The hair on my arms hurt. Everything hurt. And I just, those were the moments where I literally said, I want to die. How has my life like come to this? Like that, it's almost like that. Like that I remember questioning, like, what did I even do to deserve this? And somebody had asked me recently, their son is 15 and has Crohn's disease and is in and out of the hospital constantly, and she asked me, she goes, have you ever like asked yourself why you? And I said, yeah, I think, I don't ask myself why me every day, but there was definitely once or twice where I was like, what did I do to deserve this? Why can't my life just be easy for once? She had said I think he's 14, had said like, why is this happening to me? That's the saddest thing at 14. Like when she told me that, I cried. I mean, I used to babysit him, so I know him and I'm very good friends with, his mother and his family. And just like, I know that feeling. At 32. I can't imagine that feeling at 14. No.
Yep. Man, that's so tough.
And, I think one of my hardest things too is anytime I felt bad, and like I gave myself a lot of grace, but there was moments of being like, children go through chemotherapy, babies go through chemotherapy. I almost felt like I needed to keep like checking myself. Like, you know what? There's children that have to go through this, like tough it up. And I know that's like not a nice thing, but there was.
I know, but you shouldn't put yourself through that.
Yeah, like I thought about it all the time. Like every time that I sat in that chair and like so the realization that like, what did those kids do? 6, 7, 8, babies, toddlers that are going through treatment for leukemia or whatever. Like as even a parent to watch a kid go through that, like, what did my child do to deserve this? So I myself at 32 at the time had asked myself that, like, why me? And then like somebody always has it worse. Like, are we, I don't want to compare what I'm going through to what a toddler is going through, even though we're doing the same, we're doing chemotherapy. The situations are equally as fucking bad.
Saddest thing that I read online is that cancer is on the rise and it's affecting more and more people. It can affect anyone, not just, people who have family history. Like that's what I've learned.
Right.
I had a really hard time coping with the fact that I had cancer. I did ask myself that same question multiple times of why me? Because I felt like it wasn't fair. I felt like I should be living my life, especially in my 20s.
Right.
Like I'm too young for this shit. But I came to...
It's a great name for a podcast.
I know, right? Well, that is why we named it that way, because we're fucking young. Like this is not how I pictured my life to be, unfortunately. But,
right.
Yeah. In this next section of the episode, you are going to listen to my voice memos while I was undergoing chemotherapy. So today is Tuesday, May 18th, 2021. I start chemo on Thursday, the 20th, and right now I'm kind of feeling a little overwhelmed, especially with the amount of medications that I picked up, and it's just, for some reason, very difficult for me just to comprehend, which one I need to take at a certain time and which day and all of that. So that's been overwhelming, and just, I'm the type of person that likes to have control, and I felt like, up to this point, I had somewhat of a control of getting everything together, making sure that I bought everything that I needed, and just making a list of things I could do naturally in order to combat those, the side effects. And up to this point, I feel very overwhelmed, and it's getting kind of like surreal that I am starting chemo soon, and I don't know how I'm going to feel, within the next few months. And so it's scary, and I feel alone, and like as if this is going to be the most difficult thing that I've ever had to do in my life. I mean, surgery, of course, was pretty emotional, but I felt like I handled it well. But I think chemo is probably going to really be tough on me, and I am just not prepared to go through it. And yeah, so today is Saturday, May 22nd, 2021. 2 days post my first infusion. And so far, I feel fine. Yesterday I felt a little nauseous, but not too much. but with the Lupron shot that they injected above buttocks, it is a little bit painful. So I would say that's a bit uncomfortable. And then just feeling, a bit tiredness is what I feel. But overall, I think I feel fine. I expected that I would feel worse, but I'm glad it's just, these little like discomfort, not too much where, I'm in pain and everything. So yeah, that's just it for post 2-day infusion. Today is Friday, June 4th. I had my last chemo session on May 20th, but they told me that I would see shedding happening on day 14. So today is day 15 and I started recording yesterday. Yesterday wasn't so bad when I collected all the hair that came out of my hair, but today seems to be a little bit more. And when I brush my hair, I just kind of see all of the strands coming out. But even when I'm sitting, I just feel like the different strands all over my arm, on my leg. And so it just feels like it's nonstop. So right now I'm pretty sad because I kind of want it to stop. And even though I have thick hair, I never really had thin hair. So just knowing that there might be a possibility that my hair could be thinned out, I feel pretty upset by it. And, when I was younger, when, I would brush my hair and then I see like a little bit of hair coming out, I was like, oh, it doesn't matter. Like I have thick hair. But now that I know the reason why I'm shedding is because of chemo, I think differently and I want to save my hair as much as possible because my hair is a part of my identity and kind of, when I wake up in the morning, my hair is kind of what makes my whole day, my whole outfit, the way that, I do my makeup and such. So I really hope that the shedding doesn't get worse, and I hope I don't get any bald spots, and I hope that I can get through this and the DignaCap could do its job because I'm paying close to $3,000 for this, and I don't even know if insurance will even cover it. Yep, that's about it.
Hearing like your day before chemo or like the first clip, like I remember that anxiety so like it was literally yesterday. Like
Yeah, I had so much anxiety. I had so much anxiety that I couldn't comprehend like which medication I needed to take. It just wasn't going through my mind of like, okay, on this day, I'm taking this medication. On this day, I'm taking this, because I think my body was just in so much shock. I was like frustrated because I was like, why the fuck can't I just figure this out? But it was definitely because of the shock and the anxiety that was just all piling up. I remember every time I have chemo sessions, the day before, I can never sleep. I can never sleep well. It would affect me so much, even though like I would say like I felt like a statue, which I did. It still affected me. The thought of going into that room and like being hooked up. And the worst part of it all is just the side effects of like, fuck, 2 days after, I'm going to feel this pain. And then like a day after that, I'm going to feel tired. And, just it takes a mental toll on you.
And even the last clip of just hearing about your hair, that too, that anxiety, the cold capping and watching it like coming, and you see how much is in your brush and just on the floor and on your hands. And you're just like, every strand, like I will never take one strand of hair for granted again in my life. After this experience.
So, that was the last clip of my hair. And that time I had a full head of hair, but I would never forget this moment. I think it was like day 18 or day 19 where I really, really started to see so much hair coming out. Like I would collect all the strands and put it in a Ziploc bag so I can record how much was actually coming out. And each day, the amount of hair that came out got bigger and bigger. And I remember there was one night where I lost it. I completely lost it. I was hysterically crying on the floor. I was like, what the fuck? Why is so much hair coming out? The matting was also the worst part. I had so much matting in my hair. I was like, why is this happening to me? I'm doing everything that they're telling me to do. And just the consistent matting was just happening. And obviously I had to brush it out, and I was afraid to brush it out, and more hair was coming out. And I'm just like, damn, this is it. My hair is thinning out. And this is just reality. It was so difficult for me.
When you heard yourself say, I just hope there's no bald, I'm not having any bald spots. And like, you hear that now after you did suffer, some bald spots. Like, how is that? Like when you're like listening to yourself and you're like, you don't even know what's about to happen to you, like, yeah. Like hearing that and now knowing, it's almost like,
yeah, absolutely.
I'd be like sad. You're sitting there hoping for the best. And that wasn't what happened.
Yep. I literally thought that because, I'm doing TC, I'm doing this cold capping, like I would be able to save my hair. But I literally thought that like I wasn't going to shed that much. As naive as that sounds, like I literally thought I wasn't going to lose that much hair. I even look back through the pictures. Each month I would take pictures of my hair, of how it's being presented. And man, like I had so many bald spots.
Yeah, I have the same pictures. And I remember like, I think the last photo that I took in August, like, and you could like see my scalp. Like I thinned out so much. Like it didn't have like spots, but I had like thinned out so much. You could see my scalp, It was
same.
But now it's like insane. Now I like look at that picture and I look at my head now. I already have 1.5 inches of growth.
Mm-hmm.
My hair is looking insane. Like it's all sticking up like a cockatoo. Like it's just growing up and growing out and gray. It's upsetting. Like even looking at the picture recently, it's upsetting to look at and to be, but I also look now at my hair and I'm glad I did this. All the stress and anxiety, that it created was worth, in the end, it was worth it. The unknown was the hardest part, not knowing how much was going to be coming out, how much you were going to save.
And the part that like I want everyone to understand is that you want to feel normal.
Like yourself.
Yeah. Like going through this whole chemo treatment, you want a part of you to just still be there. That part is your hair. That's what I want people to understand, is that when you lose so much hair, like you don't feel like yourself. And I definitely didn't feel like myself, because I'm just like, well, I would look at myself in the mirror whenever I get dressed and I just hated the way it looked. Because the thing is that I would always have my hair down. I would never have it in a bun. And seeing myself in a bun, I'm just like, okay, this is new. I definitely need to cope with this. Now I've seen like features of my body that I don't like. I was like, I don't like my shoulders. I would never see my shoulders because my hair would just cover it. And, as sad as that sounds, I don't know. It's the honest truth. That's how I felt.
Right.
Like that was the most vulnerable thing that I've ever done in my whole entire life.
I'm glad we did it. To be honest, like hearing it, did it bring me back? Yes. Did it trigger some emotions for me? Yes. But like, I'm glad that we did it because that was real. Like that was really happening to us. Those were our real feelings. Like those were my real tears, like it was me in a hospital, like recording that, and like, this is real. Like these feelings are, I mean, they were fucking hard. It was hard. Everything about this situation has been hard. You see these damn pink ribbons and you see, like the breast cancer walks and everyone's fucking smiling and, pink and no, that is not what fucking breast cancer is.
Yeah. Why are people smiling? Actually, like, I did remember seeing that when I was younger, like people are smiling when they're going through walks and like, why? And I'm asking myself, why?
Somebody gifted me like she's a nurse. It's like a friend of my family is like, gifted me like all these pamphlets of just certain, different things about cancer. And she gave me this book and it's a pink book and it was like Life After Cancer or something. And this woman is smiling and that thing went right in the trash this week because I was like, you know what? Yes, maybe it is like, maybe she's smiling because she finished treatment, like whatever. But like my life right now after breast cancer, currently, I'm not smiling. Like I got to deal with a lot of shit now. And that's not a true representation of life after breast cancer. Am I happy that I am alive? Yes. Am I happy that a major portion of my treatment stuff is done? Yes. But like, I can't sit there and say that I am overjoyed right now. Like I got to learn, especially after COVID, especially after this year, like I need to learn what my life is going to be like now. And that's fucking scary.
I like completely changed my mindset. And, like I know this is really hard to do. I just am learning to live in the present. Yes, I have fears of the future, of course, but like I try to not stress as much about the future. I try to just live in the present because that's what's happening right now.
Right. I'm doing the same. Like talking to you, we've had this discussion. Actually, you are the one that kind of made me see that. Like, is it okay that I have all these fears? 100%. But that extra stress is not good on our bodies, especially after like going through cancer. Like it's just not something that I want to focus on or whatever. But it's just that picture, like life after breast cancer of this smiling woman. And it's just like, I want to be real, like that doesn't represent what my life currently is like, like it's not.
Yes. And that's valid 100%.
Yeah. I'm definitely like living, like it's just obviously it's going to be an adjustment and I'm ready to enter some sort of normalcy. I'm ready for it. It's just like, I want to just be honest with everyone that it's not just like you finish and then everyone's smiling and you're just like, yes, I'm so grateful to be alive and whatnot. But like, there's going to be a lot of hard days coming up. Like I'm ready to handle it, not looking forward to some of the hard stuff, but like, I'm ready to handle it. And I'm like open to like, just focusing on what I can control right now in my day to day, every day.
Yep.
I'm with you on that.
I definitely like when you say about the stress and how that's not good for our bodies. That's actually one of the things that can cause cancer is chronic stress. And when I learned about that, I'm just like, damn, definitely life before breast cancer, I was a very stressed person.
Yeah. I listened to this podcast. I think I've recommended it to you before. It's called Terrible, Thanks for Asking.
Oh, yes.
And I just, her husband died of brain cancer. Like, she was just great. I really enjoy it. But she did a 3-part podcast about childhood trauma and the long-term effects of childhood trauma. And that podcast changed my life. I am more, based off of the amount of childhood trauma that I've had, I'm more predisposed to cancer. My lifespan, because of that amount of stress and what that stress has done to my body, like my lifespan can be cut 20 years shorter than the normal person that didn't grow up in a situation like that. I mean, it was incredible to listen to, like scary, don't get me wrong, but like just that is what stress can do to you. That is what like trauma can do to you. Like, and it can cause cancer. I mean, granted, there's a million and one other factors that go into it, environmental, like diet, you know, whatever. Like, I'm like, I can't sit there and I'm not solely blaming my childhood trauma on my mom, you know, like my cancer because of my childhood trauma, you know, and I'm not blaming my mother for that at all, you know, like, I don't know, but just hearing like those numbers, those statistics, like was life changing for me. Let's end this on a good note. 2022. What's your plans? Like, what do you want to do now that you will be done with treatment?
I want to be a part of a dance company. That's my goal for next year. I feel like that would definitely bring some of my old self back. I'm just ready to conquer. That's what I feel. I'm feeling like I want to conquer the world and I want to continue doing dance because that's what I love. That's what I've always loved. And that's something that I enjoy and I want to continue that. So those are the two things I would say. How about you?
I think it's just going to be the year of yes. Like I am just going to do as much as I can to be happy, whether it's traveling or being with my friends or my boyfriend. To be honest, like for me, going to be finding the balance. I want to find a balance of slowing my life, you know, the pace of my life down a little bit. I want to slow down, but still be able to do all these fun things. Like I want to make sure that I'm mentally and physically taking care of my body. I'm not running myself ragged. Yeah. I want to be as stress-free as possible and finding a balance where I can just be happy all the time. You know, not all the time. Like nobody's happy all the time, but like, I don't want to stress about taking 2 or 3 days off to go and travel. I'm going to fucking do it. You know, like it is what it is. And my job is my job, but like my life is my life. And, you know, I need to find that balance. I want to go on a vacation so bad.
You haven't gone on one yet.
No, I haven't. And I mean, I have a wedding in Miami in February that I'm like, really looking forward to. Yeah. Yeah. Like I'm really looking forward to it. All my friends are going down. It's a good friend that's getting married and it's going to be fun. So I have that in my head planned, but like, you know, this summer I didn't get to go to the beach. I like want to go sit on a beach. I want like drinks being brought to me in my cabana. Like that's what I want.
You wanted to go to Hawaii actually.
Yeah.
But because of COVID.
My boyfriend's parents have a condo there and because of COVID, you know, when I wanted to go, it just wasn't a safe situation. So I'm hoping eventually I'll get there next year. What else? I mean, I really want to get another dog. I'm hoping that's going to happen in 2022.
So Phoenix to get a brother or sister.
Yeah.
So cute.
I'm really really looking forward to my having my implants. Like I'm excited for my exchange surgery. That will be in 2022. And I feel like for me, that's going to be like the final chapter of, you know, like that's the final box I get to check.
I don't want the implant surgery to interfere with me not being able to move my body. And, you know, obviously there are going to be like maybe a few days or a few weeks. I don't know how long the recovery process would be, but I feel like it'll like interfere with me trying to pursue like dance on the side, like obviously not for like income wise, but just like as a hobby. And that makes me a little upset because I'm just like, well, I kind of just want to live my life now. I don't want there to be a pause. I would say you're right in the sense of that will be the final chapter. Hopefully, cross fingers that that's the end and we don't have to worry about another surgery again. But those are all good things. So all good things.
Yeah. And for you too, like just, I think being happy is like our number one.
Right. Yep.
Like we just want to be happy and we want to be healthy. And, you know, those are ultimate 2022 goals. I'm so glad that we did this. This has been so healing and I'm so glad I got to meet you. And
yes. Oh my gosh.
Definitely.
Don't make me cry.
No, but honestly, like, it was nice to be able to have somebody that was going through it at the exact same time I was, got it, understood it. You validated my feelings in that moment. I'm so glad that we met, and I'm so glad, like, we're doing this podcast because I love this. Like, I love it. It's just like, it's been more healing than I could have ever imagined. And I hope, like, for anyone listening, like, you're not alone. Like, find your community. We're your community now. Like, if we could be a part of that healing, we've accomplished what we came to accomplish.
I also want to mention, like, the reason why I wanted to start a podcast is because I was kind of upset in the fact that, like, why wasn't any young women, like, talking about this? And of course, like, like, obviously now I see more and more young women, like, talking about it. But I guess in the beginning of my diagnosis, like, I just felt like there wasn't anyone that I could relate to. So that's why I just start this podcast, reach out to Shauna, do this together. So then we can also bring awareness. This cancer happens in 1 to 8 women. Like, that is crazy to me. And it's happening more and more to young women. So I want young women to be educated in this cancer and know that it can happen to anyone. And just really, please, just, like, take care of yourself.
Yes. Go do your annual checkups, do your monthly breast exams. If something doesn't feel right, self-advocate, go to your doctor, demand, make shit up to get the test that you need at this point, because because they will dismiss, dismiss you because of your age, and advocate for yourself, and, just you take care of yourself. That's it. That's all. And honestly, I'm pumped for season 2.
Me too.
I'm pumped. We have, like, a lot of good things coming for you guys, and hopefully get some guests on here. I think that was, like, one of the big things I wanted to do in general. Like, I want to hear other people's stories. I want to hear other people's experiences. Even though, like, you and I had, basically we had the same diagnosis. We were hormone positive breast cancer, and but we had very different views on certain things. And I love hearing other people's perspectives, and I really hope for next season we can get, a real, nice crew of people that want to come on and share.
That's a wrap for season 1. If you enjoyed this season, please rate and review our show, as it helps us expand our community. Also, share it with your friends and family and caretakers who have been affected by breast cancer. Our mission is to bring awareness of this disease among young women and provide our true, authentic stories to you all. Please check our Instagram for updates and monthly reminders to perform a self-breast exam, as early detection is key and can potentially save your life.
Season 2 is launching in 2022. We're really excited to share our health updates and experiences. Some of the topics we'll discuss in season 2 are radiation, hormone therapy, navigating life after treatment is over, reconstruction, toxic positivity, interviews with our partners and how they coped with our disease, and more. In addition, we will love to bring survivors, previvors, thrivers, and caretakers onto our show to share their stories and experiences with breast cancer. If you would like to be a guest on our podcast, please email us at tyftspodcast@gmail.com.